So the most common misconception what the general public feel is not all infections are infectious and not all infections need antibiotics. There are bacterial infections, there are viral infections, there could even be a fungal infection. So if you take an antibiotic for a viral infection, that's not going to work. So you need to make sure that it is a infection first, and then it should be a bacterial infection first. And in the bacterial infection, where the infection is in the lungs, the antibiotics are different. If it is in the urine, the antibiotics are different. All antibiotics may not be the same frame. So you need to consult the physicians, and you should take what antibiotics they prescribe based on the infection where they find, and it should be continued for a prescribed period of time. It should not, the dosage should be the same, the duration should be the same, and if you should not skip any medicines in between. The one more misconception is, recently in the COVID also we see a lot of antibiotics being prescribed, but there are no medications for viral infections, so supporting medications. So you need to use your hand hygiene predominantly whenever you go out or whenever you go outside for having any food. You should use your hand hygiene, use soap, wash it for at least 10 seconds, and then make sure that whatever the medications are prescribed should be used diligently. And it should not be misused whenever you feel having. And if there is any fever when you have, you should not directly jump to antibiotics. First, you should see why the fever is there.
That's correct. So the first and most important point here would be that please don't self-medicate. As Dr. Shashank says, it could be a viral infection. What I'm particularly passionate about in my field is ICU, and as we know that these patients who are admitted to ICU at a high risk of infections, please stick very strictly to the visitation timings and use your hand hygiene. It is not necessary that all of us visit our known patients or relatives in the ICU. It could be that just one of them goes in, spends some time there, that would be better and would help in reducing the infection transmission load in ICUs.